Dr. Stein, we've been talking about how gum disease affects the immune system of the body and can cause a whole host of problems, from premature babies, from even getting AIDS if one has the HIV virus, from being fatigued, from being getting the flu and all kinds of things, from heart attack, liver, kidney failures and all that. Now, there's also that fact that when people have missing teeth, and not necessarily do they have missing teeth, but usually that's a definite sign, and by doing so they have a misaligned mouth. Basically their hinges and the thing, it's not quite aligned, like a good Swiss watch, which is boom, 100% aligned. The reason a Swiss watch apparently and used to work so well is because, those cogwheels, they fit to the 1,000th of a millimeter, and there's no room for wiggling. And once wiggling comes in, you're off a few seconds. Now, here being off, it's like in crude terms, the hinge is not working, like using one hinge because you chew here, teeth shifting forward, shifting back, one way or the other way, tension comes up all over the face. And by doing so, people get shoulder neck pains, back pains, and headaches. How much of that is true, and can that be fixed?
Yes, that is true. It is important that things, whether it's in the mouth or in the body, when you take something out of alignment, it does create a chain of events that throws things out of alignment. In the mouth, there's a constant function, a constant change. It's built for pressure, but with time things break down. Whether it's old fillings or teeth themselves, it is important to preserve teeth or as long as possible. And in some cases, teeth have to be lost. If they are lost, it is important to replace them. There are different ways of replacing them, but it is important that they are replaced as close to the time of being lost, so that as little is disturbed as possible. We try. The ideal would be to do implants or bridges. We can go through the different what works for one may not necessarily be for the other, but the important thing is to keep things as stable as possible. In the same way that if someone undergoes a car accident, they can suffer whiplash and they suffer with neck pain and back pain and teeth pain, and they need one chain of events. One event can set off a whole chain of events. And even something like that can affect the teeth. People don't realize that a car accident, whiplash, something like that may need someone to wear a mouth guard or in some cases more extreme. They sometimes they'll need some injections, some cortisone or some steroid treatments to minimize inflammation. But whatever the case may be, we try to keep things as stable as possible and as close to the time of the event as it happens.
Right. So, would you suggest that it could be potentially beneficial for a person who, let's say, had one too many headaches in his life already, and has gone to the normal doctor, to the chiropractor, and things are not necessarily improving or not improving as much as he wants, and he might have missing teeth, he might not have missing teeth. Do you think it's prudent for him to go and say, I'm going to see a dentist who checks this out, because maybe, just maybe, my teeth are misaligned, my mouth is misaligned, my hinges are misaligned, and maybe that is causing my headache? Would that be a good move for a person to do, so that you at least can say, yes, that's what it was, we can fix it, or no, that's not what it was, you got to keep looking?
Yes, absolutely. I mean, I think you should cover all bases and treat, and it's not one thing necessarily that will treat it. It can take several treatment modalities to improve a situation, especially if it's something more involved, such as headaches, or which can be it could be a migraine, it could be something that's health related, it could be blood pressure, it could be So we want to cover all bases, to know, both to go for a physical, to check, and we're part of a team, of the medical team that can, address and help a person find out where, especially if something is not resolving, but in any event, a person, in the same way that they go for an annual physical, they should come for an annual checkup so that we can together try to figure out where the problem is, if there is a problem. Sometimes you don't want to wait till the problem is to a point where it's progressed to a much higher, more difficult problem. It's easier, whatever the case, it's always easier to fix a small problem than a bigger problem. Whether you're dealing with a car that needs maintenance, one thing, if it breaks down, then before you know it, it starts a chain of events, and it becomes a more serious problem and a more expensive problem as well.
Well, here you have it. Not only can a dentist, maybe prevent the everyday flu or underweight babies and other infections in the body, but it can also perhaps make your muscle tension in the head and the neck go away. I think that is quite something. I mean, with no doubt, the mouth, the teeth, we don't have 30. How many teeth do we have? 32? How many is it?
32.
32 and all that.
Ideally 32. Not all people have 32, but yes, there are 32 is considered the normal.
The teeth are aligned there, they're there, and the functions are enormously widespread. They go all over the body. It makes sense, really makes sense. Dr. Stein, appreciate you letting us know about it.